Could a chemical hiding in your closet be quietly scarring your liver, even if you don't drink alcohol or struggle with obesity?
Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. Today we're examining tetrachloroethylene, or PCE, a common solvent in dry cleaning and degreasers that a new analysis links to a markedly higher risk of liver fibrosis. I'm Ethan Foster. A recent review of U.S. Health Survey data found that adults with measurable PCE in their blood were about 3 times more likely to have significant liver fibrosis. The team looked at 1,614 adults tested between 2017 and 2020 and noted that roughly 7% had detectable levels, evidence of ongoing environmental exposure.
I'm Alara Sky. The dose response was striking. For every 1 nanogram per milliliter increase in blood PCE, a billionth of a gram per milliliter, the odds of fibrosis rose 5-fold. That association held across age, sex, race, ethnicity, and education, suggesting exposure itself may explain why 2 people with similar profiles diverge, with one developing scarring while the other does not.
Liver fibrosis is scarring that disrupts how you filter toxins and regulate metabolism. You might notice appetite loss, nausea, unexplained weight loss, or weakness. If the scarring becomes extensive, it can progress to cirrhosis, which compromises function and raises the stakes for future complications.
A key finding was that PCE exposure can overshadow typical liver risk factors. When this solvent was present, alcohol intake and liver fat associated with obesity did not appear to drive significant fibrosis to the same degree. That helps answer a common question: how you could develop liver disease despite avoiding alcohol and maintaining what looks like a low-risk lifestyle.
Where does exposure come from? Dry cleaning is a major source. Freshly cleaned garments off gas PCE for hours, and people who dry clean frequently, often higher-income households, may inhale more of it. Beyond clothing, the solvent appears in metal degreasing and some household products, adding inhalation and skin contact to the risk pathways.
You can't rely on smell as an early warning. PCE is a clear, colorless liquid with a sweet, ether-like odor, but the level at which you notice that odor varies widely and often occurs after significant exposure. By that time, you've already inhaled enough to matter.
Contaminated air and water also contribute. Spills or improper disposal can carry PCE through soil into groundwater, where it enters drinking supplies. Once it's in your environment, it can reach you by inhalation, skin absorption, or ingestion, and the targets extend beyond your liver to kidneys, heart, and the nervous system.
Earlier toxicology reports flagged liver effects long before this newer analysis. Workers chronically exposed in dry cleaning facilities showed enlarged livers, signs of hepatocellular injury, and elevated liver enzymes, biomarkers of cellular stress and inflammation. Those occupational snapshots mirror what the population data are now surfacing at lower, everyday levels.
The danger isn't confined to the liver. PCE irritates skin, eyes, nose, throat, and lungs with acute contact. Longer exposure has been linked to nerve damage, heart rhythm disturbances, and reproductive harms, including menstrual irregularities, altered semen quality, reduced fertility, and adverse pregnancy outcomes. The nervous system is especially sensitive, with dizziness, blurred vision, confusion, and headaches that may lift when you leave the exposure, but return when you're back.
Kidney findings are concerning as well. Chronically exposed workers have shown increases in urinary proteins, such as beta-2 microglobulin and lysozymes, early warning signs of tubular injury. Over time, those signals align with broader organ stress that you might miss if you only track symptoms.
Cancer risk adds urgency. PCE is classified as a probable human carcinogen, with associations reported for bladder and liver cancers and evidence of other sites. While regulatory actions are underway, a planned phase-out from dry cleaning and tighter workplace controls, the solvent remains in circulation and more widely used in settings without comparable safeguards.
So what can you do now to limit exposure? Shift your laundry care to solvent-free methods such as wet cleaning or CO2-based services. If you do dry clean, air garments outdoors or in a well-ventilated area for at least 24 hours before wearing or storing them. These are simple, immediate steps that lower the fumes you inhale.
Audit your home products. Check labels on degreasers, adhesive removers, and stain lifters for perchloroethylene, tetrachloroethylene, or PCE. Replace any that lists those ingredients. Each bottle you remove lightens the daily load your liver and kidneys must process.
Screening matters if you're routinely exposed. Discuss liver fibrosis screening with your clinician, especially if you work around solvents or frequently dry clean detecting fibrosis. Earlier increases the chance you can restore function once exposure drops and supportive habits are in place.
Protective habits start with what you remove and what you include. Eliminate industrial seed oils labeled as vegetable oil, soybean, corn, canola, sunflower, safflower, grapeseed, because their linoleic acid burden generates oxidative byproducts that add stress. Cutting alcohol also reduces a direct toxin that your liver must convert to acetaldehyde, easing recovery if your enzymes run high or you already show signs of insulin resistance.
Prioritize choline-rich foods that help normalize liver fat handling. Pastured egg yolks and grass-fed beef liver are top sources. Maintaining a healthy waistline remains a strong predictor of liver resilience. Combining diet quality with regular movement helps you hold that line.
Activity doesn't have to be complicated. Short walks, 10 to 15 minutes after meals, help blunt glucose spikes and reduce metabolic strain on your liver. Consistent high-quality sleep supports, nightly repair and detoxification, and early morning sunlight help synchronize circadian rhythms that guide those processes.
Because solvent exposure often coexists with other chemicals, be mindful of forever chemicals like PFAS, including PFOA and PFOS. These endocrine disruptors have been associated with fatty liver disease and can accelerate metabolic changes when they accumulate in liver tissue. Reducing exposures across categories compounds the benefit.
Here's your challenge. Over the next 7 days, switch one recurring dry clean item to wet cleaning or CO2 cleaning, air out any solvent-cleaned clothing for at least 24 hours before use, and remove one household product that lists perchloroethylene or tetrachloroethylene on the label pair, that with eliminating seed oils and alcohol for the week, adding 2 choline-rich meals, taking a 15-minute post-meal walk daily, and getting morning sunlight. Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.